Good afternoon, everybody. Welcome to our special briefing on COVID-19 for Friday, September 4th, featuring Dr. Sundari Mase, the Public Health Officer for Sonoma County. Before we get started, we have a brief message for our Spanish-speaking viewers today. Jose?
Hola, yo soy José Landaverde del Condado de Sonoma y bienvenido a esta sesión. Esta reunión es una actualización sobre COVID-19 con la doctora Sundari Mase. La presentación será en inglés y cuenta con interpretación en español. Para escuchar en español por Zoom, vaya a parte de abajo de la pantalla a la derecha, donde verá el signo del globo, identificado como interpretación, y oprime para seleccionar español. También puede escuchar esta reunión en español a través de YouTube en el canal del Condado de Sonoma. El enlace está en la página del Condado de Sonoma en Facebook. Gracias.
Thank you, Jose. And so with that, we'll now go to Dr. Mase, who will go into a little bit more on the numbers about COVID-19 in Sonoma County. Dr. Mase?
Great, thank you very much. I'm actually just going to present a PowerPoint for everybody at this time. I don't know if you wanted to give the updated numbers, Paul, or while I'm preparing the PowerPoint, or?
Sure. Let me, so as of the latest numbers are, we have additional 75 cases as of yesterday, bringing to a total of 6,142 cases. 2,360 of those are active cases and 3,689 recovered cases. We had 4 more deaths over the last 24 hours, bringing our total death count to 93 for Sonoma County. And we've had 771 additional tests for a total of 104,387 tests for the county.
Okay, great. Thanks very much for that. Are you seeing my screen here correctly?
Yes, you're up.
Okay, great. So this presentation was put together by our epidemiologist specifically to address some of the questions that the community and everybody else, the media and other stakeholders have had about why it is in Sonoma County we have a higher case rate and higher test positivity, and how do we compare with our neighboring counties. So our epidemiologists, that's Lucinda Gardner, Kate Pack, and Jen Mercado put together, and Julia Rubin put together a really nice presentation that may answer some of these questions. So as everybody here knows, on August 28th, Governor Newsom introduced the Blueprint for a Safer Economy, a new 4-tier structure for reducing COVID-19 with revised criteria for loosening and tightening restrictions on activities. This framework replaced the former county data monitoring criteria that we were using for the past several months. The new criteria, just to quickly review, consists of 4 tiers. There is a purple or tier 1, red or tier 2, orange or tier 3, and yellow or tier 4. Purple indicates widespread community transmission of COVID. Red indicates substantial disease transmission. Orange specifies moderate COVID-19 transmission in the community, and yellow minimal. Many more businesses and sectors would be able to be open in yellow and some in orange. The red really impacts schools because schools can go to face-to-face learning, not just distance learning if in the red, but in the purple, we're still restricted to where we are. The only things that opened as last week were barbershops and hair salons and indoor malls for 25% capacity. And the reason for those openings was the state determined that they were not seeing a lot of transmission in those particular sectors or businesses, and they were lower risk. Therefore, they were able to open. Now, the 2 new metrics that are being used to determine where a county falls in terms of these tiers are new cases per 100,000 population per day. And that's a 7-day average with a 7-day lag period for the state to get our data. The other measure is testing positivity, which we've always used. And that's also based on a 7-day average with a 7-day lag. And all that means is the percentage of tests that are positive over the total number of tests performed. So for Sonoma County then, given that we have 500,000 people in the population, over a 7-day average, we would have to have less than 35 cases a day over a 7-day average in order to get out of the purple and into the red. Right now, and I'm going to show you that in the next slide, our numbers are higher than that. To be in the red, you'd have to have a new cases per 100,000 population per day of 4 to 7, or again for Sonoma County, that would be somewhere between 20 to 35 cases per day over a 7-day average, and then 1 to 3.9 to be in orange, and less than 1 case per day per 100,000. So that would basically be less than 5 cases a day over a 7-day average to get into the yellow. So I hope that kind of clarifies things a bit. Testing positivity is what it's always been. If you're greater than 8% of your total tests are positive, then you're in the purple, 5 to 8% in the red, 2 to 4.9% in the orange, and less than 2% for the yellow. So how does Sonoma County compare to the region and state this week? Well, as of last Tuesday, we were one of 38 counties in the state that are in tier 1 or purple. And as you can see from this map of California, the majority of counties starting at in our area and down are in the purple. There are some notable exceptions. There's Napa that's in the red and San Diego in the red. And then some of the counties that are north of us that are smaller or have lower populations haven't been impacted as much by COVID. And so they're actually in the orange and or in the yellow. And you can see it kind of in our eastern border there. We also have some counties in the orange and yellow. But we are in good company in the purple with 38 or the majority of the other counties. The measure of spread is the R effective. I know that many people have heard me talk about the R effective or the R naught. That basically refers to the average number of additional people infected by each person with COVID. So if your R effective is 1, each person is infecting one other person. If your R effective is 2, then each person is infecting 2, so on and so forth. If the R effective is less than 1, then we are talking about decreasing spread. Whereas if it's greater than 1, we're talking about increasing spread of COVID. We're actually, the other day, we're somewhere around 0.88 or 0.9, which is actually less than 1, which is a good sign, suggesting decreasing spread. However, last week we were number 5 in terms of counties, in terms of the R effective number. In other words, the 5th highest. And now we're closer to somewhere around 13 or 14 in terms of number, the ranking of counties for the R effective. And this changes on a daily and weekly basis. You look at the COVID-19 cases by city, and we're still trying to collect this data for Cotati, but you can see that as you'd expect, we have the most numbers of cases in Santa Rosa, Petaluma, Sonoma, Rohnert Park, and then some of our more rural areas are less affected, Healdsburg and Windsor, Sebastopol. You can see Cloverdale had a recent spike, and that I think is due to some outbreaks we've seen in farm workers in the agricultural community and the Latinx. So as you'd expect, it's our urban centers that have the most cases, and you can see what the cases have been over time as well. If you take a look at the regional comparison, that's to other Bay Area counties for new cases per 100,000 per day, the 7-day average with 7-day lag, Sonoma is an outlier. We are at 15.6 cases per 100,000 population per day, whereas it looks like Alameda and Contra Costa are around 11, San Francisco around 10, Solano 9, Santa Clara and San Mateo around 8.6, Napa 6.5, and Marin 5.3. I'm sorry, 5.9. So you may and then looking at testing positivity, we're also an outlier in the Bay Area with 10.6% of our cases being positive based on our data. The state data shows we're at 6.5 or 6.4%, and we're trying to resolve that difference in result. But in our own data, which is quite up to date, we are at 10.8%. You can see the other Bay Area counties, Alameda, Contra Costa are around 6%, San Mateo at 5%, Solano closer to 4%, as is Napa, Santa Clara at 3.5%, San Francisco 3.4%, and Marin at 3.0%. So why is this? Well, it's important to keep in mind that we in Sonoma County have a few key differences from our Bay Area neighbors. Sonoma County is a home to tourism, agriculture, and industry. Essential workers in Sonoma County largely live and work within our borders, so we count them as our cases. Marin and Napa have a smaller population base. Napa is about 135,000, we're at 500,000. And the essential workers often, because they can't afford to live in Napa and Marin, live in other counties and commute from other places. So those essential workers, that's the farm workers, the agricultural workers, the vineyard workers, the essential businesses from day one, the food and beverage production, all those janitorial services, even sales and service. Marin and Napa don't count many of those cases for their county data because they don't live in their county. It's the county of residents that counts the cases. And Sonoma probably has a share of these people who work in Marin and Napa. Contra Costa, Alameda, Marin, and San Francisco do not share similar industries. They don't have significant agricultural and food production, and they don't employ a lot of the Latinx in the settings that we've already described, lead to more transmission with very close, crowded conditions and things like that. So there are some really distinct differences in the drivers of infection that we're seeing in Sonoma County versus in our neighboring Bay Area counties. In addition, we've had a very different approach to testing. We have been testing a lot and on all contacts, asymptomatic or symptomatic, from almost day one. I think in March, we implemented our very aggressive contact tracing and testing, isolation and quarantine, based on our approach, based on the fact that, I've done a lot of work in tuberculosis, which is very similar to infectious disease like COVID-19, not as transmissible. And I put into place aggressive, complete, thorough contact tracing early on. So we've actually been finding a lot of cases using these aggressive strategies for case finding. So we have an agile, responsive testing team made up of many nurses that are out there testing every single day at work sites, at communities, at facilities, vulnerable populations like our skilled nursing facilities and our residential care facilities, performing surveillance testing in the jail, in the homeless population, going to any outbreak setting and testing everybody, and doing pop-up testing, as you know, for the Latinx. Every weekend, we've been doing pop-up testing in Cloverdale, in Roseland, in Santa Rosa, and setting up sites specific for Latinx so we can find more people who could be infected. So the other thing we have is a really wonderful, large network of community clinics and other major healthcare providers that are testing all persons, giving access to care, including family members and contacts. Many of our clinics serve the Latinx. We have very high rates of positivity, which is a really good thing. It means that they're testing the right populations. They are singling out the most high-risk populations for testing. Santa Rosa Community Center, the Vista Health Center, Alliance Health Center are a few that I know that have positivity rates in the 24% range, meaning that 1 in 4 people that they're testing are actually positive for COVID. So we're really reaching the group that needs to be tested through our fantastic network of health centers. We also have a fully staffed public health laboratory. So we are not limited by access to laboratory testing or turnaround times. Even when Quest Lab had a very slow turnaround time of 7 to 10 days, our lab was doing all of our priority testing for our healthcare workers, first responders, contacts, outbreak situations, congregate centers, and still having a wonderful turnaround time of 48 to 72 hours. Now our lab is scaling up to be able to do 750 to 1,000 tests a day, which is really what we need for our capacity in our county. And currently the lab is performing about 500 tests a day. So we also have 2 OptumServe sites rather than just 1. Early on, as soon as we got our first OptumServe site, we noticed that our community had booked appointments out for a month, and we turned to the state and said, we really need another. So we're one of the few counties in California that actually has 2 OptumServe sites with 4 lanes total, able to do 560 tests per day for our community. So I guess the real takeaway from all this is while geographically close, our neighboring counties have really different drivers impacting their case rates and have very different testing strategies because of all the factors that I've pointed out. To look at a more comparable example, our epidemiologist chose Monterey County. Like Sonoma County, Monterey County has a similar population size and demographics, substantial tourism, beaches, strong agricultural and food production industries, and essential workers that live and work within boundaries, within the county. If you look at the comparison of the case statistics between us and Monterey, we're actually spot on. We're at 15.6, they're at 15.5 cases, new cases per 100,000 per day. We have a testing positivity of 10.6%, theirs is 10.9%. And our epi curves, in other words, the cases over time, look very similar, as you can see from these graphs. The race and ethnicity of our cases is similar. They have 73% of their cases occurring in Latinx. That's where we were last month before we started aggressively, or right after we started aggressively testing in Latinx. And we saw a shift from Latinx to white non-Hispanic, and because we've been testing in all the other outbreak situations that are not just Latinx. We're at 50% now. We were at 73% a month ago. And you can see the breakdown of the other race ethnicity markers. And it really is who you're testing, how much you're testing, where you're testing that leads to some of these disparities. Of course, there's real disparities in why certain races and ethnic groups have more COVID in them. Essential workers, crowded conditions, the inability to comply with mitigation measures like social distancing and physical distancing and hygiene measures, that kind of thing. We've talked about all this before. So again, Monterey County has had lots of outbreaks in the Latinx community and outbreaks amongst agricultural and farm workers. If you look at cases by age group, we're also very similar to Monterey County, as you can see, with a very similar distribution. Again, because our essential workforce is like their essential workforce between the ages of 18 and 54. And they're the ones who are out there as essential workers, working in places like agricultural, farm work, food and beverage production, et cetera. So there's very similar trends seen in cases by age group between us and Monterey County. So again, what's our takeaway from all this? Sonoma County's pattern of cases is similar to other counties that share our demographic, industry, and tourism profiles. Focused case finding efforts, extensive field testing in vulnerable populations, such as our skilled nursing facilities and residential care facilities, at work sites, and systematic testing of all close contacts, both symptomatic and asymptomatic, have yielded a higher number of positive cases. And yes, it does show us as having a higher test positivity rate, but it's a good thing because we're finding the cases and finding them quickly, getting them to isolate out of the community, getting their contacts to quarantine and be tested. So it's actually a really, in the long run, this is how we're going to beat COVID, is by doing all of this. Of course, in addition to other things that are around the corner, hopefully vaccine and more treatments. So what can Sonoma County do now to slow the spread of COVID-19? We can continue this focused approach to testing, contact tracing, and data-driven case finding that we've been discussing. We can reinforce the importance of wearing facial coverings or masks, social distancing, hygiene measures, wearing masks when ride sharing, especially on the way to work, van pools, things like that. And we can avoid gathering, especially as we're coming upon a long weekend here. For Labor Day weekend, it's going to be hot. The air quality is poor. I highly recommend people stay in their households with their household members and don't gather in large groups, either indoors or outdoors. We can encourage workers to stay home when ill. Make sure people don't report to work, especially in healthcare settings when they are ill. We can urge employers to provide sick leave when possible so that people don't have to go to work when they're ill. We can provide outreach to the agricultural industry, skilled nursing, and other congregate and vulnerable settings to strengthen prevention and mitigation measures, which we're doing. and which we're doing also through our Latinx work group. So I think I am going to end there. I do believe that is the last slide. I'm going to stop sharing, and we can take questions now.
Okay, I think we're going to end our recording there. Thank you very much, Dr. Mase. We really appreciate that overview.